Dr.N.H.Krishna, pulmonologist from Davangere, Karnataka, India. I am here today to tell you certain things which are universally pertaining to asthma allergy patients. These are applicable to every patient who is breathless, who is having allergic rhinitis, who is having bronchial asthma. This is applicable to every one of them. So kindly listen to this very carefully and switch off your mobile while listening to this. First and foremost, I would like to bring it to your notice that all such illnesses like bronchial asthma, allergic rhinitis, what you call as dust allergy, allergic cough, allergic cold, allergic bronchitis, whatever you call, whichever you feel like, chest tightness, breathlessness, COPD and all these illnesses what you hear of daily. Kindly don't be under the impression that these things, these diseases will get cured in a span of 1 or 2 weeks. Just keep this in your mind that you need to take treatment for these illnesses for your entire lifespan. That means you should take medication for this not for 15 days, not for 1 month. You should take this medication for these illnesses for a lifespan. I quote you certain examples here. It is something like, you have fever, you go to a doctor. The doctor prescribes you certain medication. After a week span, the fever is gone, the medication is empty. This you call it as cure. But whereas, some more example, something like, you become blurring vision, you get the blurring of vision. You have problems in viewing things. Then you go and meet a doctor. He prescribes you spectacles. You have to wear the spectacles for your entire lifespan. You have diabetes mellitus, you have hypertension, BP. You go to a doctor, he prescribes you medication. It is understood that you should take these medications for the entire lifespan. In the very similar pattern, how you take medication for hypertension, diabetes mellitus and for refractive error, that is for viewing spectacles, wearing spectacles, in the very same pattern, you should take treatment for your breathlessness, bronchial asthma, allergy for your entire lifespan. But there is a very beautiful difference here between those illnesses and this illness. See, in the case of diabetes mellitus or hypertension or while wearing spectacles, as and how you grow older, the dosage will be increased, the spectacle number will be increased. The patient who used to take some medications initially for hypertension or diabetes mellitus, his dosage will be increased when he attains old age. But in our case, how and you become alright, how and you take the treatment properly, the dosage will be decreased. Imagine, for initial 1 month span, you come to me, I prescribe you some medication. After 1 month when you come to me, I may not be able to stop that medication, but I will definitely try to taper, to bring down the dosage of that medication. So this is a matter so that you become thrilled about pediatrics population. If the baby is treated regularly with inhaled medications and on regular review with the doctors, then only in pediatric population 80% of the children will they will get rid of the illness when they become adults. That also means that 20% of the pediatric population children are supposed to take this medication for the entire lifespan. One more thing. The people who are taking treatment for these illnesses, they will have to regularly monitor themselves. If the people take proper treatment for these illnesses, if they are on daily medication with inhaled medications and when they come to a doctor regularly, they will be as good as they don't have the illness. It is almost like they feel nothing has happened to me and I am not having any illness. There are instances that such bronchial asthma patients have climbed Himalayas, they have taken part in Olympics, they have won medals. So what I want to assure you people is, if you have regular medication, then you can definitely live a normal life, a healthier life than like anyone else. I want to bring it to your notice that what are the things an asthma patient or allergy patient should stay out of. First and foremost, I would tell you, smoke, dust, pungent smell. I repeat this for you: smoke, dust, pungent smell, that is strong smell. So these three things are enemies for any patient who is having asthma or allergy. So before prescribing medication to these people, it is essential that we write to them an anti-pollution mask. You must have seen such masks, people wearing in the traffic on a two-wheeler going out. But such masks, similar to them, such masks are there which have to be used by these people. Such masks have to be used only in those circumstances where they are, and imagine you are here. If there is no smoke, no dust, no pungent smell here, you need not wear any mask. But if you are in a place where you are exposed to these things, smoke, dust or pungent smell, it is mandatory that you wear it. Imagine you are sitting in your house, someone is sweeping, someone is dusting, cleaning the dust from the sofas, or you have your mother cooking inside, the cooking smell comes out, the smoke from agarbattis, the smoke which you get from lobana, the smoke which you get from anywhere else which are harmful to you, the smoke fumes. Such circumstances, it is essential that you please wear the anti-pollution mask. Especially, I would like to bring it to notice of the females. Females who are working in kitchen should definitely wear anti-pollution mask daily without fail as soon as they enter kitchen till they come out of the kitchen. So using a mask is mandatory, and such masks will last with their filters for 6 months span only, after which that doesn't work. So after 6 months you need to throw your mask and buy a new mask. Not just in the house, when you go out on the streets, the pollution from the vehicles, the dust from the vehicles, in such circumstances also you need to strictly wear the anti-pollution mask. People will ask me that what do I recommend for diet? Well, I don't give them a huge list. I don't tell them that you don't eat this, you don't eat this. I don't give them a huge list. I just tell them two things: stay out of oily foods and sour foods. Oily foods and sour foods. But without using oil and some sour, you cannot prepare anything in India. You use oil for cooking. They use lemon, that is again sour to taste while cooking. But the oil and the lemon or whatever sour thing that is used while cooking, that is acceptable. But you are not supposed to eat this directly. So you should never eat sour fruits. Something like pineapple, orange, mosambi, grapes, mango, such fruits which are sour to taste, asthma allergy patients should never eat. They can definitely eat sweeter fruits like watermelon, sapota, apple, etc. The patients of asthma and allergy, they should never try to eat pickles. Pickles are shunned off from their meal pattern. They can eat curds and they can drink curd milk as long as it is not sour and it is fresh. If the curd carries any layer of fat above it, take it out and then eat the curd. So one more aspect other than this is oily foods. What oil that is allowed to be used while cooking? Other than that, don't use anything which are studded with oil, vanaspatis and ghee. Like something which is prepared out of a lot of dalda in it, a lot of ghee in it, a lot of oil in it, they should not use this. Other than this, every patient who is having asthma allergy, they carry several myths. They carry a lot of myths. Such myths do include that you should not eat banana, you should not eat cucumber. They'll ask me, can I eat cucumber, can I eat banana, can I eat mutton, can I eat egg? Well, I will tell you, eat everything of this, try it on your own and see whether this really reflects on you, whether this makes any allergic reaction in you. So you go and try these things. What happens is, usually someone would have tried eating banana, he would have become allergic to it. Then he keeps on telling to the entire village that you don't eat banana. After eating banana, I got this cold, I got this cough. So listening to him, don't decide your own allergy pattern. What is allergic banana to that patient? It is his own type of nature, his own body nature, that he is allergic to banana or cucumber. Everyone in the world need not be allergic to banana and cucumber. So you try it, you eat it. If you feel it doesn't hurt you, you can keep eating it for your rest of lifespan. So I tell you, don't decide your allergens or which food is allergic to you asking someone else. You try it on your own and you decide. But stay out of sour foods and oily foods. The people who are suffering with bronchial asthma, allergic rhinitis, they should stay out of cool drinks, ice creams and frozen foods. Other than this, the people who are suffering with bronchial asthma, allergic rhinitis, they are not supposed to change the type of drinking water. They can get accustomed daily to their own house drinking water wherein 10 people drink it. But preferably that should be filtered and that should be a clean water. So I don't advise my patients that they should drink every day that water which is first initially boiled and then cooled. Or I don't tell them to drink hot water. You can drink normal cold water like anyone else drinks at your house. But you see to it that it is clean. But when you go out from your house to some other place, when you travel across, at that time you need to carry your drinking water of your home there, or when you have no choice to drink a water from a different city, then you boil it then and drink. The drug ibuprofen is present in some tablets like popularly known as Brufen, Combiflam and all. In such patients who are having body ache and all, fever, as a painkiller this is used. That could be used in normal subjects, but this cannot be used in bronchial asthma and allergic rhinitis cases, in allergy cases, because once you use it, you will start developing breathlessness. And during a head bath, an asthma allergy patient should not take head bath like this. They should not wash their head so that the water drops into before their nose. They should wash their head bending their neck back side. One more aspect, the people who are having any other doubt other than what I have told to you regarding the illness, they can talk to me directly. It is very essential we maintain a very strict structure in our clinic. We see to it that our patients buy the entire medication and show it to us as a must. We definitely entertain them to come on regular dates. A patient who wants to visit to our clinic, he should call 08192 232302. I'll repeat it again, 08192 232302 between 10:30 AM in the morning to 8 PM other than Saturdays and Sundays. So take a prayer appointment before you come. I hope I have done cleared some of your doubts and I have given some patient education via this. Thank you very much for your kind listening.